Hello, my name's Rhiannon. I am a doctor of physical therapy, pelvic floor, and sports physical therapist, and owner of Revive Physical Therapy in White Bear Lake, Minnesota. And yeah, I do really a combination of sports PT and pelvic floor. So if you've never heard of pelvic floor PT or if you've heard of it, we're gonna dive into a little bit of like what the pelvic floor is, all that good stuff. So yeah, that's me. And then Paige is hopping on
Yeah,
to join us today.
yeah, happy to join and be here. My name is Paige Olson. I think I know some of you that are watching today, but I am fortunate to be a good friend of Rhiannon, a patient of Rhiannon, and an avid cyclist myself. I work my career as a partnerships manager at a digital musculoskeletal and pain management company. I'm also a certified personal trainer. Don't use that a whole lot, but and I'm a kind of bike saddle tester and bike fit tester by necessity, not by trade. And so I'll definitely share some of that today and some of the challenges that I've faced and hopefully help others not feel so alone in just feeling healthy and comfortable on the bike. So yeah, super excited to be here today.
Yeah, we're so pumped. Yeah, we realized this was like such an important topic that people don't talk about enough. So, being a pelvic floor physical therapist, I talk about like all the things that are like TMI everywhere else in the world all the time. So, um, no questions are off limits. If you guys want to comment during and ask a question, if we know it and we can, we'll answer it. Otherwise, if there's something new or different, we can totally look that up for you too and see if we can come up with an answer. You'll see that like within the pelvic floor world, especially within like female anatomy and cycling, there's definitely not a one size fits all. So a lot of times we end these with more questions than we started with. But if you have something that you have a question with, we would be super happy to answer that. Yeah, we actually came up with this idea when we were biking together last summer. It's probably, yeah, last
Yeah, I think
summer. We
so.
were biking and Paige was starting to talk about some of her um, trials and tribulations with finding a bike seat. And I started talking about pelvic floor stuff, and we're like, wait a second, like, this is like where our worlds collide.
Yes. Yeah. And we were doing a bunch of research too, and there's so much out there that today will probably be kind of high level, but if there's an area that you're super interested in or like really piqued your interest, like maybe we can do another one where we dive a little bit deeper. But I know one thing that piqued my interest too in our conversations is like I, as a woman, should know more about the pelvic floor and like what it is. And that's a term that I've just started to become more familiar with over the last couple of years, to be honest. Um, can you like share a little about like what is the pelvic floor? Like why are we even talking about this?
Yeah, 100%. I feel like this is something we should learn in like high school health class, but we don't. And so yeah, let's jump into that. So I have my handy dandy pelvic model here. This is one of my favorite things I've ever bought, and anyone who like has come to my office or my home has probably seen this. Yeah, so a lot of people are like, what the heck is the pelvic floor, and how does it even relate to cycling and biking? Because obviously there are a lot of issues that pop up around that. So a little anatomy lesson for you guys today. I love anatomy. I find that people that are like active tend to like it too, but I apologize if I bore you about this, but I think it's pretty fun. So we're gonna pop in to start talking about the bone. So this is a pelvis, like this would be me facing you. This is the front of the pelvis. So pubic bone right here. So if you have your hands on your lower belly and you just kind of walk them down your lower belly until you hit a bony prominence, that is your pubic bone. It's a spot where both of the sides of the pelvis connect. There's a little bit of cartilage here. It is also a kind of a common place to get some compression when you're biking as well. So we also have, if we go down to the bottom, so this person is like laying on their back, tailbones here, pubic bone here. We've got our sitting bones, your ischial tuberosities, those bones you feel when you're sitting on some like hard ground or hard chair. Bringing that person back up, turning around, and we've got tailbone in the back. Sacrum here also, you'll see that like some of these pelvic floor muscles also attach onto the sacrum, and there's some ligaments coming through here too. So I wanted to jump in first and talk about a little bit of the difference between like male and female bony pelvis, because obviously there's differences between the genitalia, but the bones, we have some differences too here. So one big thing that most people are like somewhat aware of is these ischial tuberosities are actually wider in females. We tend to have wider pelvises. In general, if we look at this, the female pelvis is going to be a little bit more like shorter this direction and wider towards the sides. So these bones, and they're where most of like our weight bearing happens, are wider in females. So you can already start to like get your brain thinking about like, oh, most bike seats were designed for men. How might this be a problem? I don't know.
Mm-hmm. Mm-hmm.
The other big thing that I think is important to look at is the front of the pelvis. So this angle here, in females is wider than it is in males. So we see that this angle is usually like closer to 90 degrees and a little bit more open on the front of the pelvis. I only have a female pelvis here, but compared to a male pelvis, it's going to be a lot narrower here. And so what happens though is this area on the front here is just so much more open and like vulnerable to pressure compared to a male pelvis. No, this is not to say that male pelvises do not have issues with pelvic floor and cycling, because they absolutely do. But we're going to be talking about female pelvises today, because that is, it's more confusing, to be honest. There's just less research about it in general, and there are just more variables too. So that is one piece of this that is going to make the female pelvis anatomically different for how it's sitting on a bike seat. Hopping into some of the more like muscular structures, we've got our pelvic floor muscles. So they are over the entire bottom of the pelvis. There's actually 3 layers of them. And there's a like deep, middle, and superficial layer. So there's a lot more to pelvic floor than like just the muscle group as a whole. We have muscles that wrap around the vagina, muscles that wrap around the urethra, muscles that wrap around the anus, and then these like kind of bigger structural muscles that are supporting the bladder, uterus, rectum, and they also have a big role in sexual function and yeah, and your core too. It's kind of part of the whole core system. So if you think of your deep core, pelvic floor, it's all working together. That's what it looks like from the top down. You'll see it like that too. You can also see that they, they kind of connect to a lot of different parts of the pelvis, that your hip muscles, your glute muscles, your inner thigh muscles all attach into here. So it really is part of like a whole system. Okay. And feel free to jump in if you have questions too, Paige. I'm
Yeah.
just going to get a little more nitty gritty with some of this stuff.
Yeah.
Yeah.
Absolutely.
Yeah. So another thing that I feel is like pretty important with this is there is it's called a neurovascular bundle that comes out from around the sacrum and then branches into the pelvis here. So there's a nerve called your pudendal nerve and a couple blood vessels that run with that too. And these nerves come up through here and they supply the skin around the genitals in males and females. So genital numbness is something that can be an issue with cyclists, depending on bike seat, just the structure of your pelvis in general. That numbness, this nerve also supplies the clitoris, the urethra, so we can have issues with difficulty peeing after riding, painful urination. Sometimes people even have some blood in their urine after riding. So that all can play into the urethra and urinary symptoms. Sexual function as well. This nerve supplies, the clitoris, the penis in males. And so if there are issues with that, there's been some research that shows genital numbness, some difficulty reaching orgasm, erectile dysfunction in males can be associated with compression of this nerve. And this nerve too, like, you think we're just sitting right on it too. And all of these connective tissues and muscles can get really like tight and kind of, almost like stuck where the fascia and muscles aren't moving well. We're not getting good blood flow. And that's part of where pelvic floor PT can come in. We do vaginal, internal, rectal work to help release these muscles, get blood flow, get the connective tissue moving better. from kind of more a PT standpoint, and then we'll get into some of the bike fitting stuff later too with Paige, but that's kind of where that comes from. Pelvic floor can be strong, but also really tense, and so sometimes we get some interesting things coming along with that too. Let's see, I think, yeah, so that is most of like the internal structures. And then another thing that we look at is like externally more like soft tissue, also a really common issue in cyclists, and that can involve like swelling of the labia minora, labia majora. I'd say that is one of the more common soft tissue problems. There's been some, I dove into a bit of research on this, and there's been some less research people that were kind of citing like labia length in terms of like the type of bike seat. And I think one thing to remember too, that like labia minora majora, the variation of them is vast, and they're all for the most part normal. So over half of people with vulvas have labia minora that extends outside of their labia majora. So totally normal and natural. And in fact, most of those are asymmetrical. Most people have one that's like a little bit longer than the other, or maybe it looks a little bit different, but totally normal to have some that maybe protrude out a little bit, maybe they don't. All of those are normal and natural and fit into like the normal spectrum. And as a pelvic floor PT, I see a lot of vulvas, and I can attest to those research stats that there's a lot of variation. And yeah, and sometimes that has something to do with the issues you're having, and sometimes it doesn't. So I never like diagnose someone just based on that anatomy, because my first assumption is that it is normal, but at the same time, depending on the anatomy, sometimes that can put you at maybe a little higher risk for certain types of soft tissue problems of the vulva. You can get swelling of the, so I throw those terms around a lot too, labia majora, labia minora. So we're talking about like the labia majora is on the outside, and then the labia minora is on the inside. Again, size-wise, they could vary a lot. Color-wise, they can vary a lot. Yeah, so we can get swelling there, and a lot of it's just from pressure, compression. Yeah, and sometimes this becomes chronic. Sometimes it's like we have so much tension in the pelvic floor too that we're not getting this lymphatic flow, where we're getting the swelling kind of coming into the vulvar area, and we're not getting this lymphatic flow, this blood flow carrying that swelling back out. And so sometimes we get this that kind of becomes stagnant and becomes a little bit more chronic. So also something that, along with, you know, making these adjustments and bike fitting and such, that we can work with like the soft tissue in physical therapy to release that and get that lymphatic flow working again too, to help kind of shunt that out and normalize that a bit as well. That on top of, gosh, all sorts of like chafing and yeah, abscesses. We can have all sorts of ththings going on just with the skin there too. And I'm sure Paige can attest to this as well. Part of the reason Paige has been so helpful is like, I am a pelvic floor PT, I bike recreationally, but Paige is like in the bike world, like understands a lot of the bike stuff very well, and kind of all the stuff that you guys deal with on a regular basis. So yeah, super important stuff, and she can talk about that stuff too. I think for the most part, anatomy wise, that is like the quick and dirty of pelvic floor. Yeah, so we will jump into some other stuff as Paige talks about her experiences too, and like the bike fitting stuff, but that's where we'll start out. So yeah, so over to you, Paige.
Yeah, that was a great and I think very important anatomy lesson, because I think when it comes to pain and cycling, it's the most helpful to know your body and like identify where your pain is coming from. And if you caught what Rhiannon was just saying too, we're all so different. I mean, and that should be celebrated. We all have different shapes and sizes and colors, and that's why a lot of today is about finding what works best for you. And I know, Rhiannon, you mentioned a ton of the anatomic pieces that play into females specifically and what might impact us as cyclists, and things like your pubic bone, perhaps your really you're a road cyclist and you're always leaning really far forward on your bike, this can result in the bone resting on the nose of your saddle if you don't have a proper saddle or you have improper bike fit. We can get sit bone pain because we don't have the right saddle width. We can get that kind of lower back coccyx pain if your saddle's too soft, for example. And then I think the hardest part that you mentioned too is to solve for is the soft tissue pain. And that's another one that's just associated with maybe more that forward leaning position. We've got a sensitive undercarriage that, wasn't necessarily meant to be on a saddle all day. And so, personally, we wanted to do this because I've gone through a journey, let me tell you, of comfortability on the bike. And I think I was in a place of thinking, oh, I just have to deal with being uncomfortable, like for a while, I can go for about an hour or two and then have to shut it down because I'm super uncomfortable. But there are so many things we can do to feel better and feel comfortable and, fit our bikes to our bodies in a way that allows us to feel really free biking. And there's a few reasons we're feeling all this discomfort and we're experiencing this anatomical pain. And now that we've got the background of the anatomy that Rhiannon shared, it's so much more helpful for me even to just like visualize where the pain is and where it's coming from. And it's no surprise that saddles and bikes probably weren't tried and tested on women in particular. So like, how do we figure this out, right? I think the first step, if you haven't done this before, if you've got some cash lying around, is to get a professional bike fitting. That's kind of pushing it off to someone else, but I do think that's really important. And if you're not quite ready to go get a professional fitting, there's a few things that you can do at home to try to get the right fit so that your sit bones, your labia, everything feels right and is in the right position so that you're comfortable. And a couple big pieces of this are saddle height is a big one. The height of your saddle balances the weight between your three main points of contact, which is your feet, your hands, and your crotch. And if the saddle is too low or too high, it kind of forces the weight away from your feet or for your hands onto either your sit bones or your pubic bone or places that you don't want all of that weight to be. So making those small saddle adjustments in small increments until you feel balanced between those contact points when you ride is super important. That's one area that I didn't have too much trouble with, but the next piece, saddle tilt, is one that I had a ton of trouble with trying to get comfortable. And just to share a little bit about my experience, I kind of went through, I got a bike fitting done, and then I've probably gone through 15 to 20 saddles to try to get the right piece. So when I did the bike fitting, they're doing things like saddle height and saddle tilt. And what I would recommend with saddle tilt is that's just, how forward, back, or flat your saddle is on your bike. At a starting point, you should try to start it in a neutral position and see how that feels. If it's pointed too far down, it's going to have your body move forward, so you're going to get more pressure maybe on your pubic bone and more pressure on your hands, which isn't going to be comfortable in the long term. Ultimately, you want to have even pressure amongst those points. So play around with the tilt of your saddle, and it'll depend on the type of saddle too, but the most minute adjustments can make a huge difference, but I definitely wouldn't tilt it too far because that's going to have you kind of slide forward a bit. The third piece is kind of the fore-aft adjustment of the saddle on the stem. So if this is your bike stem, you can move the saddle back and forth, and that's just going to get you in the right position kind of totally when you're pushing your pedal so that your crank arm is horizontal to the ground. Your kneecap should be positioned directly above the pedal spindle. That's going to put you in the right position, but if you're sitting too far back or too far forward, you're not going to be able to do that. So a couple things that you can tweak at home to try to get more comfortable. But honestly, I would recommend getting a professional bike fitting done. It's totally worth it, in my opinion. If you're going to be on the bike a lot, just on recreationally, that's a great starting point. But I think that the kicker is like a big reason why I wanted to do something like this is saddles in general, because I like to cycle. I love to cycle, and there were points where I had a ton of pain in pretty much all parts. I was kind of oscillating between back pain, pelvic pain, sit bone pain, because I just couldn't find the right fit. And I had the bike fitting done, which was great, but the saddles just weren't working for my body. And so I think finding the right saddle is kind of the final piece of the puzzle here. At least it was for me, and it's still an ongoing journey.
Yeah.
And I have a ton of saddles here I can share, but like Rhiannon, anything resonate with you there, like from your perspective and your expertise?
For sure. Yeah. So, you know, right, like bike fitting so important that we're not like putting excess pressure on certain areas. And I think part of one of the tricky things too with the bike fitting is as we're like shifting some of those variables that you like so beautifully outlined, we're shifting the pressure to a different area. And so, there was some research that showed that like a bike saddle that was like shifted back caused people to like lean forward a little bit more and increase pressure like on the front of the pubic bone. So you can imagine if you're having to lean forward, everything's tilting. And so we got more pressure here. And so this study was like, oh, great, like let's, shift this back to like neutral or slightly forward. And I think the tricky part is though, like, yeah, so maybe a seat shifted slightly back increases pressure on the front if you're having issues with stuff on the front. But if your issue is more your low back or your tailbone, that could potentially make that worse. So it is a little bit of like a two-sided thing of finding that balance, like you said, of what issues do I have? Where can I tolerate that
Mm-hmm.
pressure? And kind of trying to find that middle ground of having a good setup. And yeah, I mean, there's so many factors to this, right? Like your own personal like anatomy, your bike fitting, and then the saddle, which is, I mean, if anyone has gone out and tried to look at saddles, there are a lot of them. There is some research on them, but there's not enough. And yeah, it really is
Mm-hmm.
tricky. And some of the studies that show that like something that worked for men doesn't necessarily work for women. And so yeah, it's tricky.
Mm-hmm.
So I just want to like validate anyone who is watching this and is like, I've tried everything, I'm frustrated, this is my sport, this is what keeps my mental and physical health, and you're dealing with pain. So I just want to validate that this is not easy, it's not straightforward, and there's not one right answer.
Mm-hmm.
So yeah, and we appreciate Paige sharing all of this too, just to kind of show that of like, a real life example of that too. So yeah.
Yeah. And I think our all of our bodies are different, yes, but even our own bodies can change over time. I mean, things like pregnancy, menopause, just where you're at in your cycle, like you can have more swelling in your labia if you're like in certain parts of your cycle. And so what I was talking about was paying attention to where you feel the most pressure. So if you're kind of working out saddles, you're working out fit, are you feeling the most pressure on your sit bones? Are you feeling uncomfortable pressure on your pubic bone? Are you feeling uncomfortable pressure like on your vulva and labia? Because those are going to require kind of different tests to try. And I think probably one of the hardest things for women is figuring out what's comfortable for your soft tissue. Because some people have like think about like the belly button terminology, innie and outie. Some people have innie labia where it's kind of contained, and some people have outie labia where it's a little bit more free flowing down there. There's a bit more going on. And different saddles can be really uncomfortable for that. So some people like saddles with cutouts because it might give you more relief and have less pressure on your labia. But what I will say about this is this can also give you the feeling of kind of falling into it and getting more pressure on the outsides of your labia as well. So this might not be the best fit for some people. It may work for others. Again, this shape is so dependent on your body shape. And this is a SELLE saddle. But for people that this doesn't work for, something maybe like this is called a specialized mimic, and it has this squishy part on the inside that is supposed to kind of mimic your soft tissue. So it gives you support, but it's a bit squishier, so it's not this kind of hard shell that you're leaning forward into. So some considerations if you're having soft tissue pain is cutout, no cutout, what's most comfortable for you. There's a ton of
Can I
options. There's
jump
things,
in on the cutout thing really quick?
yes.
Okay, cool. Yeah, so cutouts are, from what I found, like a pretty common. Oh yeah, Paige has tried a bunch of the
I
cutouts.
have a lot.
Um, yes. Oh my gosh. I feel like if anyone else has a million bike seats, take a picture of all of them and like post them,
I'm gonna
because
start a
I think it's just like,
library.
yeah, because it's like you try so many of
Yes.
these, right? And they're all different variations that are supposed to fix different things.
Hmm.
Um, yeah, so cutout, I feel like cutouts were made for like a lot of times people trying to, yeah, create more space for like female anatomy. And I think on like a soft tissue side of it, right, like makes sense. We're creating a little more space for those tissues to not be in friction with the bike seat. And so for a lot of things like, yeah, soft tissue irritation of the inner outer labia, great. Although some stuff is showing now though that, and we had talked about this before too a little bit, that like these cutout seats can actually make some pelvic floor issues worse, unfortunately, because there's no support there. And so the second page note had some support, which is kind of a cool idea. Too, that like if you're dealing with a lot of swelling, sometimes you can get increased swelling because there's nothing counteracting that
Hmm.
pressure that's dropping down. And then the other thing is right where that cutout is right through here, and that's right where that nerve comes in. So this
Hmm.
nerve issue, if you have any issues with like genital numbness or urinary symptoms, sometimes that cutout can make those issues worse by like cutting in right in that spot where we don't want increased pressure.
Hmm.
So just another of those, like, make it a little bit harder of like, yeah, helpful for some things, can actually make some pelvic floor issues worse. So if you've tried cutouts and you're like, oh my gosh, this didn't work, is something wrong with me? No,
Hmm.
it's just that it's like no one size fits all with this stuff. So
Yeah.
as many of you know, because you've tried many bike seats, is really like not only condition dependent, like what your symptoms are, but also person dependent on your anatomy. And yeah, yeah. And I think, why don't you keep doing the bikes? Keep showing
Yeah.
us more seats. Otherwise, I'll keep rambling. But I have a couple other things
No,
to
it's
add after you're done
helpful.
talking about
I mean,
those.
it's really helpful to see like the correlation between where this is on your body and like why. Because I tried a bunch of cutout seats and it would be comfortable for like 10 minutes. I would be in heaven. And then once it really started to dig in, then I would be like, no, not gonna happen.
Mhm.
Um, but there are like, in terms of cutout seats, there's not many brands out there, but there are some that are actually like adjustable. So this is called a bisaddle, and you can actually like adjust it. Like if you had super wide sit bones, so you have this whole central area, or you can kind of adjust it together. So they do have adjustable options too that you can try. The challenge with these is getting the right distance for your sit bones and the right place for your pubic bone. Um, I just bought two of these. I haven't tried them yet, so I will report back on how those feel.
Yeah, has anyone
But
tried those ones yet?
I don't
If you have,
know, I
a comment. I'm curious because, yeah, it's nice. Like the wider seat, a lot of times is helpful, right? Because
yeah.
of the wider ischial tuberosities too. That, yeah, maybe you're looking at your distance between the
Mhm.
sitting bones.
Yeah.
So yeah, I like the idea of it. I'm curious to see how it goes for you.
We'll try it out. I fell target to an Instagram ad on these, but I'll let you know how it goes because I think the soft tissue part is one of the hardest nuts to crack. But there are other things that cause issues if you don't have the right saddle. One is definitely where your sit bones land. So if you have a saddle that's too wide or too narrow, um, it's not gonna feel right. And so you can get your sit bones like measured at your local bike shop. Otherwise, what you can do is get like a piece of corrugated cardboard and sit on it where your sit bones are kind of digging into it so that it makes an impression. Um, but it's really important to find the right width of saddle because ultimately your sit bones are your anchor. Like you don't want to have pressure on the outside of your glutes or the inside of your glutes. You want it to be your sit bones because those are what you're perched on. And if you have sit bone pain, one thing I would say is if you go and like sit on a park bench and the only thing that's sore are your sit bones, that's honestly probably a good thing. Like ask yourself, is this just because it's early in the season and I haven't been biking very much and I just need to kind of get them acquainted? It does take some time to get your sit bones acquainted. But if you have the right width of saddle, that can make a big impact too. Because if you think about it, if you're sitting on a saddle, and this is kind of like a stock saddle that you would typically come with a stock bike, and let's say your sit bones are sitting way out here when they should be like in here on a saddle, you're going to have pressure in the wrong places and it's not going to be comfortable. So if you have sit bone pain and it's like ongoing sit bone pain, what you can do is try to find a squishier saddle. Like this has a little bit more squish to it, but my caution there is if it's too squishy, you sink into it and then the rest of your pelvic bone, your soft tissue are kind of squishing into it anyway. So you don't have those sit bones kind of perching you up on your saddle. But make sure you have the right width. They come in, I think it's centimeters or millimeters, but it'll be kind of this part of the saddle. And each saddle, if you order one online, it'll have the widths in there as well. Any anatomical thoughts there?
No, I love it. I think the wider seats definitely, there's some good research that shows that the wider seats are helpful for most things for females. And yeah, we all have wider pelvises, but also there's variation like female to female anatomy too. So it's tricky, but like wider, I think just in general, wider seat is a very good thing.
As long as your sit bones are in the right place, we'll say. Because
Yes.
you could, if it was too wide, if you're like me and you have some good thighs on you, your inner thigh might like rub on this part of the saddle. So annoyingly, another thing to keep an eye on is like the shape. You've got saddles that have this really like kind of thick, I don't know what you would call this, but angle here. And then there's others that are a little bit more kind of narrow as they come down. So leg shape even plays into this. But I think really what it is figuring out where you're feeling the most pressure and testing a few things out and seeing maybe the right saddle for you. And again, it's no one size fits all. It's your size fits you, and sometimes it does take some testing, but kind of thinking about those three things, your sit bones, your soft tissue, your pubic bone will help at least guide you towards the right type of saddle.
For sure. Yeah, that was so helpful and helpful just to even like see the different comparisons too.
Yeah.
Have you had any luck with, one thing I was looking at was like handlebar height compared to your seat level. Have you had any luck with like shifting those around to kind of shift what part of your pelvis you're sitting on?
Yeah, definitely. And I think that'll depend too on like the type of cycling you're doing. If you're kind of cruising around casually and you want a higher handlebar height just because you're kind of hanging out, you can certainly do that, but that will bring you further back where then you're sitting further back on your tailbone, if you will, so you get more pressure on your sit bones and on your butt. But if you're maybe road biking or mountain biking, you want your bars to be more in line with where your saddle is. If they're too low, that's going to pull you way too forward, and then you're really putting pressure on your pubic bone. So you want to make sure they're not sitting too low. But I think one of the things with your handlebars to keep an eye on too is your reach. So one of the things I realized when I got a bike fitting done is I was reaching way too far. I was like almost had straight arms going out to my bars, which really made me move forward and put too much pressure on my pubic bone. And so there's something on your bike called the stem that connects your handlebars to the bike essentially. And they come in different lengths. Mine was like about this long. I needed one that was about this long. And so just changing the stem length, which is something the bike fitter did for me, made a huge difference where I was able to be in a neutral position. My arms are kind of bent. I'm in a very comfortable position where I'm not reaching. I'm not like kind of back here like a T-Rex. So yeah, handlebar height and just distance out from your body make a huge, huge impact on where your weight is sitting. And again, it depends on what type of cycling you want to do, right? If you're like a triathlete and you're sitting super far forward on aero bars, then you're going to have more pressure moving forward, and you might want to try a saddle that's more of a split nose saddle, which would mean the the two parts come straight down, and there's usually more space here in a split nose saddle, but definitely can make a big impact for sure.
Yeah, yeah. And then just, I mean, I think taking into consideration all of those things, like the type of cycling you're doing too, of, yeah, we like that lower handlebar is going to increase pressure on like front of the pelvic floor, that nerve area, pubic bone, urethra, even like all of that. But also like looking at if you're racing, right, you kind of have to be down at that level too, and kind of weighing the pros and cons of like being able to train in that way while keeping in mind, the issues that can like come from these different positionings. And yeah, there's just a lot, I think, to this.
Hmm.
Um, yeah, that involves even, yeah, like the type of cycling you're doing, or if you're,
Hmm.
racing versus doing more casual biking. Yeah,
Yeah.
so it really is very person to person.
Yeah. Yeah. And even the equipment you use makes a big impact. Like a good pair of bike shorts is great, but that's even nuanced. So if you're a person that you're having a lot of soft tissue pain, sometimes a super tight pair of bibs or chamois can put more pressure on your soft tissue. And so wearing a thinner pair can sometimes help with that too. So even when it comes to bike shorts, it's going to be really personal to you, and that makes a big difference too. If you're improper, if your bike's not fitting properly, if your saddle's not fitting properly, and you're just getting saddle sores up the wazoo, that's no fun either. And all the things we're talking about kind of play into that too.
Yeah, definitely. I think too, the other thing to remember also is like, even if you have like the perfect like bike setup, the perfect, seat and everything, like the biking is just, we're not used to like putting that much pressure. Like humans are not made to put that much pressure on your pelvic floor. So
Hmm.
just keeping in mind of that too, like it is the kind of hard on the body, and making sure you're doing other things that like can support you when you're you are biking, and maybe when you're not too. Like certain things, like if you tend to be prone to having a lot of pressure, and maybe you find out like you have some adhesions and some issues with that too, like getting some work done from a pelvic PT, around the glutes, around the perineum, around those pelvic floor muscles. Sometimes just getting some somewhat regular work done to get that like lymphatic fluid to go in, get those muscles loosening up to, working on some of that connective tissue. If you are in a season where you're going really hard and you've kind of got everything else lined up and still struggling, that may be something to work on too. I oftentimes give people some like pelvic mobility work, some breath work to kind of work on to get those tissues like more, like perfused, and getting more blood flow through there and getting things loosening up there as well. Sometimes putting a cold compress over your vulva, working on, yeah, lymphatic flow. And then depending on like the setting you're biking into, like maybe standing up and just giving your perineum a break from time to time. Um, yeah, and just thinking of different ways that you can kind of support your body in the sport that is, inherently you have some risk with that, just because of the sport that it is.
Yeah.
Yeah.
Yeah, and I'm wondering too, like you mentioned at the beginning, all the things that women are probably dealing with, or many of us have dealt with if we're trying to cycle long distances, like genital numbness, UTIs,
Mhm.
like just trouble peeing after a long ride. If someone has gone through the process of like, okay, I've fitted my bike, I found a saddle that like works pretty well, what are the triggers that you think someone should then maybe seek extra help, like figuring out what's going on with their pelvic floor, or maybe having some exercises to do at home, whether that's breathing or like core strengthening exercises. What would some of those triggers be?
Yeah. So, genital numbness would be a big one, just a sign that there's some compression of that nerve coming through there. Any sort of pain that feels like it's around the vagina. Sometimes people get like clitoral pain, um, labial pain that is potentially related to like swelling too. If you have some like significant swelling that doesn't, go away, or if it's coming back really regularly. Sometimes that would be helpful to get some work done, just working on that blood flow, like we talked about. Tailbone pain, urinary symptoms. Some people do get leakage with cycling as well, but I'd say more often it's this, excuse me, like pain with peeing after biking, or it's just like really difficult after. Those would all be big ones too. But yeah, any sort of like leakage that you're having, and then pain with intercourse or pain with any sort of like vaginal penetration, tampon use, pain with sex, all of that can be related to issues with
Hmm.
pelvic floor muscles and nerves. And know that too, like you don't need a prescription to see a physical therapist in Minnesota. So you can go, unless depending on the clinic, sometimes they're a little bit like weird about it. But for the most part, like you don't need a prescription. You can go in and have an evaluation and be like, hey, I don't know if this is wrong, but you can go in and have a pelvic PT assess you and answer your questions. And maybe they say, hey, no, you're good. Like, go see a bike fitter, get that figured out. Or maybe they say, hey, we found a couple of things. Let's work on these. Let's get you some like stuff to do at home to work on it. And yeah, and come up with a plan for you. So yeah,
Hmm.
those would be
Yeah.
my big ones. Hmm.
Yeah, that's super helpful because I'd imagine like luckily I was able to get to a point where I got comfortable, like, and none of the pain what didn't go away after a long ride. Like it might take a day for the pain to go away, but it wasn't ongoing. So if you have like ongoing symptoms, it might be worth, seeing a PT for it. But I'm sure there's other things too, that would help. I know one other thing that I had noticed about myself that probably a lot of us experience is just your pelvic tilt, because I think we all have a little bit of a different pelvic tilt, and doing some functional core strength
Hmm.
really helped me with my kind of lower abdominals. Granted, I should do more abs than I do, but with the lower abdominals and kind of the transverse abdominals, that helped with that, I guess, keeping my pelvis in the right place. Um, and you can probably speak more to the anatomy of that and why that would help.
Sure. Yeah. Yeah. Just overall, like pelvic stability too. Women generally just have more mobility in their hips and pelvis, so they're more likely to have their pelvis like shift forward or backwards, which is worsened by a poor bike setup, obviously. But there's just more movement here, right? Like we have to have more mobility in our pelvises. So working on what we would call lumbopelvic stabilization,
Ah,
which is a fancy way to say that we're stabilizing this area of like the deep core, transverse abdominis, like obliques, those guys, and trying to balance them with pelvic strength too. So we may also check in on your pelvic floor strength. That's something that I test on people too. And if there's weakness in there, I know I mentioned this at the very beginning, that the pelvic floor is really part of the core. And so if those things are imbalanced and you have some weakness just around the whole pelvic structure, that pelvis is going to be more at the whim of every movement of that bike or anything that happens.
mm-hmm,
It's going to be a little more wibble wobbly. And like you said, like especially with a lot of women more prone to that anterior pelvic tilt, putting pressure on the front part of the
mm-hmm.
pelvis and leading to all sorts of things. So yes, thank you for bringing that up. Definitely um, core pelvic floor strength, lumbopelvic stabilization,
Hmm.
if you want to throw that term out
Yeah,
there. But yes,
yeah,
definitely.
yeah. Well, for those of you who have been sticking with us through the technical difficulties and have kind of heard the whole piece, you're probably feeling overwhelmed, as am I, because there's like so much here, and there's a ton of research, there's a ton of anatomy that plays into how to feel good, but it's so individual. But hopefully, some of this has helped arm you with trial and error, from myself, but also giving you some good like anatomy nuggets. And if there's like things that y'all want us to dig deeper into, like I'm sure we could spend an hour on just like pelvic tilt. I know Rhiannon could because she's incredible at her job and
So,
very knowledgeable. But
well, thank you, Paige. I've learned so much from you too, just yeah, from your personal experience and just everything you've, brought to the table of all the research you've done yourself too. So, yeah, yes, but yeah, we'd be happy to dive into like any one of these topics more maybe at a later time. So if there is something else that you guys are interested in, let us know. We would be happy to chit chat a little bit more. Obviously, there's a huge world of like pelvic floor and cycling that we are still learning so much about. So let us
mhm.
know. And yeah, if you have any questions, otherwise, thank you everyone for who hung in with us through our technical difficulties. Hopefully, I'll be able to get that stitched together for when we post it.